parathyroid disease is frequently underdiagnosed. Dr. Jaffe, how did perk products and the LRA testing help someone with this situation? Maybe
Well,
underlying even.
Well, what is the parathyroid system? Because it's four tiny glands in each quadrant of the thyroid itself. So it's not the thyroid, it's embedded in the thyroid. When I say parathyroid disease or parathyroid imbalance or parathyroid dysfunction, what I'm really talking about is ionized calcium and phosphorus. So if I was worried about parathyroid problems, the first thing I would do is get an ionized, not a total calcium, I would get an ionized calcium. And then I would get a phosphorus on the serum, and then I would get a urine, and I would start with just a spot urine, any urine, on which I would also measure calcium and phosphorus, but I might also measure magnesium, potassium, and sodium. Because these mineral imbalances kind of go together. We think of the parathyroid dysfunction or problems in relation to calcium and magnesium, and they are, absolutely. And just to mention, Dr. Richard Egdahl was the surgeon. He was also the chief of surgery at my medical school, but he was the surgeon who invented parathyroid surgery. And he was my advisor in med school. He was an amazing man and brilliant surgeon. He revolutionized adrenal surgery. He revolutionized thyroid surgery. He made it safer. He made it easier. That meant better outcomes. And I was, quote, there. I was just looking. I was just watching as a student. But he did inspire me. He did inspire me because he said, you know, we have to understand the physiology more than the pathology. He told me that. He started me on that path, which has continued for decades and continues to this day. So parathyroid problems relate to everything from how your muscles function to how you feel. So how would I know when to screen for parathyroid problems? If you have an unexplained muscular disorder, if you have an unexplained connective tissue disorder, if you have an unexplained disorder of any kind, one of the things to check is your ionized calcium and your phosphorus. It can save your life. These are available tests. These are not esoteric tests, but you have to do the right test, and then you have to get someone who understands the endocrinology of the parathyroid to interpret the tests. The interpretation could be more valuable than the test itself. The first thing is do the tests. They're fairly simple. But then work with someone who understands endocrinology, hormones, and parathyroid, who understands minerals and essential nutrients. Maybe someone who is certified by our PIH Academy, maybe someone who has investigated us through drrusselljaffe.com or on YouTube, Dr. Russell Jaffe, or through Health Studies Collegium. We are learning more and more every day about the biology. We are learning more and more every day about how to promote good health and well-being. And it turns out to be very different than suppressing symptoms and treating the consequences rather than the causes. So parathyroid dysfunction is mostly a metabolic causal problem. Yes, if you follow our LRA plan and you therefore repair yourself better, if you include the supplements that we think are essential and good hydration with healthier beverages, and you're active, mindful, and physically, I would say most, if not all, of the parathyroid problems that I have seen in the last few decades have completely responded well to this kind of biologic, physiologic, repair promoting, health enhancing, lifestyle using program. The one exception, and I do need to mention, not to worry you, but to say, you know, from almost every perspective, there's an exception. Sometimes the parathyroids are acting up because the rest of the body is in trouble. So don't focus too much on the parathyroids to exclude some potential significant risks with regard to cardiovascular health, with regard to digestive health, with regard to metabolic and detoxification health, because your parathyroid glands can be knocked off their rhythm if you're out of rhythm in general. So I would urge you to look first, as I have guided you, and then think about our 4 self-assessments and our 8 predictive biomarkers to really profile yourself in the 21st century, to know with lifestyle and epigenetics what to do, not just about your parathyroids, but your thyroid, your adrenals, your testes or ovaries, your pancreas, all of you.